There's a quiet moment, just before you fall asleep. Your body is still, the room is silent, and for a second, you feel safe. But deep inside your chest, your heart is still working, pushing blood through vessels that have carried you for decades. And somewhere along the way, someone told you, "Don't worry, just take this pill. It will control your blood pressure." That's si indak. So you did. Every morning, every night, without question. But what if I told you that the very pill you trust, the one you never miss, might be quietly working against you? Not in a dramatic, obvious way, but slowly, subtly, in ways most people never connect until it's too late. Because the truth is, many people don't feel worse overnight. They just don't feel like themselves anymore. They wake up a little more tired, they walk a little slower, they forget things they used to remember, and they never suspect it could be coming from the very thing meant to protect them. If that thought unsettles you, it should, because this isn't about fear. This is about awareness. And today, we're going to talk about something most doctors don't have time to explain. Not because they don't care, but because the system was never designed to slow down long enough to ask, how does this medication make your life feel? Welcome to Healthy Aging with Dr. Emily Carter. This is a place where we don't just chase numbers on a chart. We listen to what your body has been trying to tell you all along. And if you've ever felt like something isn't quite right, like your energy is fading, your mind is foggy, or your body feels heavier than it should, then you're exactly where you need to be. If you value your health, not just surviving, but truly feeling alive, consider subscribing. Not for me, but for yourself. Because the small insights you gain here could quietly change the trajectory of your life. Now let's talk about that pill. You were probably told it's essential. That without it, your blood pressure could rise, silently damaging your arteries, increasing your risk of heart attack or stroke. And that part is true. High blood pressure is dangerous. It's often called the silent killer for a reason. But here's the part that rarely gets discussed. Lowering your blood pressure is not the same as restoring your health. And this is where so many people get lost. Because medicine often focuses on controlling a number, not understanding the person behind it. You see, your blood pressure is not just a random measurement. It's a signal. A reflection of what's happening inside your body, your stress levels, your blood vessel health, your hormones, your sleep, your lifestyle. It's your body speaking. And when we silence that signal too aggressively, without asking why it's happening, we can create a new set of problems. Subtle ones that don't show up clearly on tests, but you feel them deeply. Let me ask you something. Have you ever started a blood pressure medication and then, weeks or months later, noticed that your energy wasn't the same? That you get tired more easily? That standing up too quickly makes you dizzy? That your hands and feet feel colder than they used to? Or maybe something harder to explain. A kind of mental fog, a heaviness in your mood, a quiet sense that something inside you has slowed down. Most people don't connect these dots. They assume it's just aging. They tell themselves, "This is normal. I'm getting older." But sometimes, it's not aging. Sometimes, it's the way your body is responding to being pushed in a direction it didn't naturally choose. Let me explain. Your body is constantly balancing itself. Blood pressure rises and falls throughout the day based on your needs. When you stand up, it adjusts. When you exercise, it adjusts. When you're stressed, it adjusts. It's not meant to be artificially flattened into a perfect line. And when certain medications lower your blood pressure too much or too consistently, it can reduce the flow of blood to places that need it most. Your brain, your muscles, even your kidneys. Imagine a river that once flowed freely, now slowed down too much. The land around it begins to dry. Not dramatically, but gradually. That's how these effects feel. You don't suddenly collapse. You just feel less alive. And here's the psychological trap that keeps people stuck. You trust the prescription, so you ignore the feeling. Because in your mind, the pill equals safety, and questioning it feels like taking a risk. But what if the real risk is never asking the question? Now, I need to be very clear about something. This is not about telling you to stop your medication. That would be dangerous. Uncontrolled blood pressure can cause serious harm. But there's a deeper conversation that needs to happen. One that goes beyond, take this and you'll be fine. And sure start chin to die and die. Because not all blood pressure medications are the same. Some can affect your energy more than others. Some can impact your electrolyte balance, leaving you feeling weak or drained. Some can slow your heart rate, making your body feel like it's always in a low-energy state. And in older adults, the effects can be even more pronounced, because your body is more sensitive, more reactive, more vulnerable to subtle imbalances. I've seen patients who did everything right, and by our far, then bakshur sartar. They took their medication exactly as prescribed. Their numbers looked perfect on paper, but their lives didn't feel right. They stopped walking as much. They lost interest in things they used to enjoy. They became quieter, more withdrawn, not because they wanted to, but because something inside them had shifted. And when we finally looked deeper, when we asked the right questions, we realized that the issue wasn't just their blood pressure. It was how their treatment was affecting their whole system. This is what most people don't realize. Health is not just about avoiding disease. It's about preserving vitality, clarity, strength. And when those begin to fade, even slightly, your world becomes smaller. You stop taking the long walk. You choose the chair instead of the stairs. You say, maybe next time, more often. And slowly, life becomes something you observe rather than fully live. All while your chart says, everything looks good. That disconnect is where the real danger lies, because it teaches you to stop trusting your own body, to ignore the whispers, to accept less without questioning why. But your body is not trying to betray you. It's trying to communicate. The fatigue, the dizziness, the brain fog, these are not random. They are messages. And when you learn to listen, you begin to take back control. Here's something else to consider. Sometimes the issue isn't just the medication itself. It's the combination of things. Multiple prescriptions, small lifestyle habits, hidden dehydration, poor sleep, all stacking together, quietly amplifying the effect. For example, if your medication lowers your blood pressure, and you're not drinking enough water, and you stand up quickly in the morning, that lightheaded feeling you get, that's not just one thing. It's a chain reaction, and most people only see the surface. They don't see the system underneath, but once you do, everything changes. Because now, instead of blindly following instructions, you become aware, curious, engaged in your own health. You start asking better questions. Not just, what should I take? But, what is this doing to me over time? How do I actually feel? Is there a better balance? And this is where real transformation begins. Not in a dramatic moment, but in quiet awareness, in noticing the small things you used to ignore, in realizing that you deserve more than just manageable. You deserve to feel alive, strong, clear, present. And here's the part most people don't expect. Sometimes the solution isn't about removing something. It's about adjusting, refining, personalizing. Because your body is unique, your life is unique, and your treatment should reflect that. Not a one-size-fits-all approach, but something that truly supports you. And that starts with awareness, with paying attention, with refusing to accept silent decline as just aging, because it's not always. Sometimes, it's simply a signal that something needs to change. And the sooner you recognize it, the more power you have to protect the life you're still building. So, tonight, or tomorrow morning, when you take that pill, I don't want you to feel fear. I want you to feel awareness, presence, connection to your body. Ask yourself, quietly, how do I feel, really? Not what the numbers say, not what you've been told, but what your body is experiencing. Because that question, simple as it sounds, might be the most important one you ask for the rest of your life. And this is just the beginning, because what we haven't talked about yet are the specific types of blood pressure medications. The ones most commonly prescribed, Zevers, Bactisen Shi, and the subtle ways each one can affect your body differently, and Satan Shi Setchar, down Sebursar, in ways most people never realize until years later. And this is where things become even more quietly revealing. Because not all blood pressure medications affect you in the same way. On the surface, they all seem to do one simple job, lower your blood pressure. But inside your body, they take very different paths to get there. And those paths matter more than most people ever realize. Let's start with one of the most commonly prescribed types, the ones that gently slow your heart down. They're often given to protect your heart, to reduce strain, to create a sense of calm inside your cardiovascular system. And for many people, they do exactly that. But here's what you might not have been told. Your heart is not just a pump. It's part of your energy system. It responds to your emotions, your movement, your sense of vitality. So when it's slowed down too much, or too consistently, some people begin to feel something difficult to describe. Not pain, not illness, but a quiet dullness, like your body is moving, but without its usual spark. You might notice you don't feel as motivated to move. Climbing stairs feels heavier. Even excitement feels slightly muted. And over time, you may begin to wonder, is this just who I am now? But sometimes, it's not. Sometimes it's your body adapting to a rhythm that no longer matches your natural pace. Then there are medications that work through your kidneys. They help your body release excess salt and water. And in doing so, they lower your blood pressure. Again, this can be incredibly effective. But here's the hidden layer. Water in your body is not just fluid, it's balance. It carries electrolytes, tiny charged particles that control your muscles, your nerves, even your heartbeat. And when that balance shifts, even slightly, your body feels it. You might feel weaker than usual. You might notice muscle cramps at night, a strange fatigue that doesn't go away with rest, or a subtle sense of dehydration, even when you're drinking enough. And again, most people don't connect it. They blame their age, their schedule, their sleep. But the truth is, your internal chemistry has changed. Quietly, gradually. Then there's another group. Medications that relax your blood vessels. They allow your arteries to open wider, reducing the pressure inside them. It sounds almost perfect, and in many ways it is. But your blood vessels are not just passive pipes. They're dynamic. They adjust constantly to keep your brain supplied with steady blood flow, especially when you change position, like standing up. So when they're kept too relaxed, your body can struggle to adapt quickly. That moment when you stand up and feel a sudden wave of dizziness, that brief sensation that the world tilted for just a second, that's not random. That's your brain receiving just a little less blood than it needs in that moment. And while it passes quickly, over time, these moments add up. They create hesitation, caution, a subtle fear of movement. You start to move slower, more carefully, and without realizing it, your confidence in your own body begins to fade. Now here's where it all becomes deeply personal. Because none of these effects are guaranteed. Some people take these medications for years and feel completely fine. But others feel these changes so gradually, so quietly, that they don't even realize what they've lost until something wakes them up to it. A conversation, a moment of clarity, or simply the realization that they don't feel like themselves anymore. And this is where psychology plays a powerful role. Because once you accept a narrative, I'm just getting older, you stop questioning, you stop exploring, you stop looking for answers, and that belief becomes a ceiling, a limit on how good you think you're allowed to feel. But what if that ceiling isn't real? What if your body is capable of more, but something in your current routine is holding it back? This is not about rejecting medicine. It's about understanding it, working with it, making it serve you, instead of silently shaping your life without your awareness. Let me tell you something I've seen over and over again. The people who age the strongest are are not the ones who avoid all medication, and they're not the ones who blindly follow every instruction without question. They are the ones who stay engaged, who stay curious, who notice the small shifts in their body and ask, "Is this normal for me, or is something influencing this?" Because that question opens doors. It leads to conversations, adjustments, better combinations, sometimes even small changes that restore a surprising amount of energy and clarity. But none of that happens if you never ask. There's also something else, something even more subtle. Over time, when your body adapts to a certain medication, your baseline changes. What once felt low energy becomes your new normal. What once felt like brain fog becomes something you stop noticing. It's like living in a room that slowly gets darker. At first, you notice the dimming, but eventually, your eyes adjust, and you forget how bright it used to be. Until one day, something shifts, and you remember. You remember what it felt like to wake up clear, to move without hesitation, to feel fully present. That memory can be both beautiful and painful, because it shows you what's possible and what may have been quietly slipping away. But here's the empowering truth. Your body is incredibly responsive. Even after years, it can adapt again. It can regain balance. It can feel better. But only if you give it the chance. Only if you stop ignoring the signals. Only if you start paying attention to the relationship between what you take and how you feel. And I want you to notice something important here. This is not about making drastic changes. It's not about fear-driven decisions. It's about awareness-driven refinement. Small, thoughtful adjustments. Better conversations with your doctor. More honest reporting of your symptoms. Not just the obvious ones, but the subtle ones too. Because sometimes the most important symptoms are the ones you almost don't mention. I feel a bit more tired. I get dizzy sometimes. I'm just not as sharp as I used to be. These are not small things. They are clues. And when taken seriously, they can lead to meaningful change. Now, there's one more layer we need to talk about. And it's something almost no one considers. Timing. Not just what you take, but when you take it. Because your body runs on rhythms, your blood pressure naturally rises and falls throughout the day. Your hormones follow patterns. Your energy shifts in cycles. And when medication timing doesn't align with those rhythms, besmesh bastur besh dasaw dala, it can amplify side effects, make mornings harder, make nights more restless, create fluctuations that leave you feeling off balance. This is a detail that often gets overlooked. But for some people, adjusting timing alone can change how they feel dramatically. And yet, they live for years without ever exploring it because no one told them it mattered. But it does, more than you think. So, as you listen to all of this, I don't want you to feel overwhelmed. I want you to feel awakened, not to danger, but to possibility. The possibility that your current state is not fixed. That how you feel right now is not the best it has to be. That there may be small, hidden factors influencing your energy, your clarity, your strength. And that by becoming aware of them, you begin to take your life back, piece by piece. Because aging is not just about time passing. It's about how you experience that time, whether you feel present or distant, strong or diminished, alive or simply existing. And sometimes, the difference comes down to things no one ever explained to you, until now. But we're not done yet, because there's one final piece to this puzzle, something even deeper than the medications themselves. It's the hidden habits, the daily patterns, the things you do without thinking, that quietly interact with your medication, either helping it or working against it. And once you see this, you'll never look at your routine the same way again. And now, we arrive at the part that almost no one talks about. Not your prescription, not your diagnosis, but your daily life. Because what you do every single day, the small habits you barely notice anymore, are constantly interacting with that pill you take, sometimes supporting it, sometimes quietly working against it, and sometimes amplifying its effects in ways that leave you feeling worse without ever realizing why. Think about your mornings for a moment. You wake up, maybe a little stiff, maybe not as refreshed as you used to be. You sit up slowly, and there's that brief pause where your body feels like it needs a second to catch up. Most people ignore that moment, but it matters. Because if your blood pressure is already being lowered by medication and your body is slightly dehydrated from the night, that simple act of sitting up can create a sudden drop in blood flow to your brain. That lightheaded feeling, that's not just getting older. That's your body asking for better support. Now think about water. Such a simple thing, so easy to overlook. But dehydration is one of the most common hidden factors that changes how your blood pressure medication affects you. When you don't drink enough, your blood volume decreases, and if you're taking medication that lowers pressure on top of that, it can push your system just a little too far. Not enough to cause alarm, but enough to make you feel off, tired, slower, less steady. And the dangerous part is, this doesn't feel like dehydration. It feels like you. So you accept it, but your body is simply trying to function with less than it needs. Now let's go deeper. Salt. For years, you've probably been told to reduce it, and in many cases, that advice is valid. Too much salt can raise blood pressure. But here's the nuance most people miss. If you're taking certain blood pressure medications, especially the ones that already remove salt from your body, and you also drastically cut salt from your diet, you can create an imbalance, one that leaves you feeling weak, dizzy, even mentally foggy. It's like removing too many supports from a structure that still needs balance. And again, this doesn't show up as something obvious. It shows up as a quiet decline in how you feel. Now think about your sleep. Not just how long you sleep, but the quality of it, because poor sleep raises your stress hormones, and those hormones push your blood pressure up. So your medication works harder to push it down, creating a kind of internal tug of war. And the result? You wake up feeling like you never truly rested. Your body spent the whole night fighting for balance. And over time, that tension wears you down. But here's where it becomes even more subtle. Stress. Not the dramatic kind, not the obvious kind, but the quiet, constant pressure you carry without realizing it. The thoughts you replay, the worries you don't express, the sense that something in your life feels unresolved. Your body feels all of it, and it responds. Your blood pressure rises, not as a flaw, but as a reaction, a signal. And when medication lowers that signal without addressing the cause, the internal stress doesn't disappear. It just goes underground, and your body continues to carry it. This is why some people feel physically controlled, but emotionally still tense, still restless, still not at ease. Because true balance isn't just chemical, it's psychological, it's emotional. It's deeply human. Now, I want you to imagine something. Two people, both taking the same blood pressure medication, same dosage, same diagnosis, but one of them drinks enough water, moves their body daily, even gently, pays attention to their sleep, manages stress in small, consistent ways, listens to their body, and the other ignores these things, lives on autopilot, pushes through fatigue, dismisses the signals. On paper, they look the same, but in reality, their outcomes will be completely different. Because medication does not work in isolation. It works within the environment you create inside your body. And that environment is shaped by your daily choices. Now, here's the moment where everything comes together. The realization that changes how you see your health forever. Your pill is not your solution. It's a tool. And like any tool, its effectiveness depends on how it's used and what it's used with. If the foundation is unstable and the tool can only do so much. But when the foundation is strong, that same tool becomes far more effective with fewer side effects. And this is where your power lies. Not in rejecting what you've been given, but in understanding how to support it, how to balance it, how to make it work with your body instead of against it. Because you are not passive in this process. You are not just someone who has high blood pressure. Imbiti and now. You are a living system, dynamic, responsive, capable of change, even now, especially now. And I want to speak to something deeper inside you. And das kar ana. Something you may not have put into words yet. That quiet feeling that maybe, just maybe, you haven't been feeling as good as you could. That something has been slightly off, not enough to panic, but enough to notice. In those quiet moments, when you're alone, when you're honest with yourself, that feeling is not something to ignore. It's something to explore. Because your body is not trying to fail you. It's trying to guide you. Back to balance, back to clarity, back to a version of yourself that feels more alive. And the path back, but see our birthday afbenchi is not complicated, but it does require awareness. It requires you to slow down, just enough to listen, to notice, to ask better questions, to have more open conversations with your doctor, not just about your numbers, but about your life, your energy, your mood, your experience, because those things matter more than you've been led to believe. And as you move forward from this moment, abersi da ing I indash dan. I don't want you to feel fear when you look at your medication. I want you to feel understanding, curiosity, control. I want you to see it for what it truly is. And dai mi shak idak kurger. One piece of a much larger picture. A picture that includes your habits, your thoughts, your environment, your awareness. Because when you start seeing the full picture, you stop feeling like something is happening to you, and you begin to realize you have a say in how this story unfolds. And maybe, just maybe, the next chapter of your life doesn't have to feel slower, conqueror, Dutch, shy, weaker, dimmer, but instead, more intentional, more balanced, more alive than it has in years. So tonight, when everything is quiet again, and you feel that stillness before sleep, I want you to remember something simple. Your body is always speaking, not loudly, not dramatically, but consistently. And the more you learn to listen, the more clearly it will guide you, back to the version of yourself. And you thought you had already lost.